Okay, so for this case study, we have Mrs. Washington, who is scheduled to have a knee replacement on her left knee, and she is supposed to be doing physical therapy prior to surgery. And she is in a lot of pain, so she is obviously a little hesitant and doesn't want to come to therapy. So for question one, some of the questions that could be asked of the patient when in the beginning of treatment and at the end. Some examples are on a scale of 1 to 10, 1 being the lowest and 10 being the highest. What is your pain right now? Is your pain localized to the knee, or does it spread to other parts of the leg, such as the thigh or the calf? And what kind of pain are you having, such as dull, achy, or sharp? For question number 2, we looked at some different tools that could be used to assess pain. The first one is the numerical rating scale, which is a tool that uses a numerical system from 0 to 10, and 0 being the least and 10 being the worst pain. And this scale is best used for patients that either have a language barrier, such as patients that cannot speak English or would have a hard time telling you how much pain they're in, or a patient that cannot speak, such as somebody who is dumb or deaf. The second tool is the Brief Pain Inventory short form, and this tool allows patients to rate the severity of their pain and the degree to which the pain interferes with their daily activities of life. This tool is best suited for patients that have a diagnosis of cancer, cerebral palsy, or spinal injuries. And the third tool that can be used is the McGill Pain Questionnaire short form. This tool is designed to assess both the intensity and the quality of pain. This tool is best suited for patients with arthritis, patients that are going through cancer rehab, or patients that are going through sports medicine, such as basic physical therapy. So when you look at modalities that can be used to relieve pain, some of the modalities that can be used to make Mrs. Washington's knee pain a little bit less severe, I believe, would be heat and electrotherapy. The heat will help the tendons and the ligaments loosen up and become more elastic, and which will result in increased range of motion and decreased pain. And electrotherapy, such as TENS, has been shown to reduce pain in patients with osteoarthritis. This, however, needs to be done several times in order for it to actually reduce pain. So I currently don't have a partner for this, but I will be using a pillow to simulate a partner. And when Mrs. Washington is hesitant about coming to therapy, some of the things that you could reassure her with would be an example of this. So, Mrs. Washington, I understand that you are a little hesitant and you don't want to do therapy, and you don't understand why you need to do therapy. But therapy will help you recover quicker. Therapy will make your tendons and ligaments a little more loose, which will result in a quicker healing time and less pain after the surgery. For question number 5, it asked if you know anybody, or if you yourself ever had an injury or been through a time when you had a lot of pain. A couple years ago, I ended up fracturing my ankle, and obviously that was very painful, and I was in a lot of pain. And when I had to do physical therapy, I didn't want to do it because it was just painful, uncomfortable, and really difficult. And I remember I dreaded going to these therapy sessions, and I kind of hated my therapist because he would really push me. And I kind of understand why somebody with osteoarthritis would be hesitant to come to therapy or do physical therapy when they are in a lot of pain. So some things that you can say to a patient like that to reassure them or encourage them to do therapy would be examples of this. I understand you are in pain right now, but this will help you heal quicker after surgery and decrease your pain afterwards. Physical therapy will help decrease your pain. And you can also tell the patient that you will use heat before and after the treatment to help them feel better and to decrease their pain.